Hi guys, hope everything is okay with everybody. I've, like I told you, I've started dental school. I've actually left my day job, which was at a primary care health facility, which was in government, and I'm working in private in general practice as well as doing ENT calls, which just started this week. It's been pretty busy. Uh, Trying to get adjusted to the whole dental life because dental school has a lot of quizzes and a lot of assignments, which is a bit different from medical school, which is not as it's hectic in medical school, don't get me wrong, but the amount of quizzes or the number of quizzes that they have in dental school is just it's bam 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 one after the other. If it's not a quiz, it's an assignment. If it's not an assignment, it's a quiz. So that's been challenging, trying to get to simulator to get some simulation hours in. So this dental school actually ascribes to the whole dental simulator before actually touching official patients. The simulator is interesting. It's a bit challenging because you have to try to, when you're using certain instruments, you have to try to ensure that that instrument is picked up by the sensor. So when you're using the instrument, it's a bit, and you hear like the screen just turns red and tells you that they can't pick up your movements. So that you have to ensure that you hold it correctly. To start off the whole simulator, you have to. I was advised to treat the simulator like if it's a patient, because once you go and actually start seeing patients, that it really helps. I must say though, when I was in medical school, you would hear doctors and nurses always speak about professionalism, but trust me on this. I was explaining this to some of my colleagues this week. I was saying being professional is a must, and it sounds like really repetitive, but dealing with patients, sometimes patients are very combative, sometimes patients can just not understand what you're saying, and therefore they can then turn that into aggression. And simply just keeping your cool or just being mannerly and polite and soft-spoken can simply quell all that anger one time. And I'm speaking from experience with both patients in general practice as well as patients in ear, nose, and throat. I'm trying to get as much experience in ear, nose, and throat as possible because for the UK and the US, well, more so the UK, to do oral and maxillofacial surgery, you have to have about 6 months of ENT experience as well as 6 months of plastic surgery experience. So I'm trying to make sure I get that out of the way as well. If I can log as much hours as possible and then subsequently do my diploma in head and neck surgery, I think that would. I'm thinking that might help me in my dental goals. I was here studying and I just got a little bit frustrated, so I said let me just do some blogging, and hopefully I can vent as well as help you understand what it's like to pursue oral and maxillofacial surgery. Well, I'm not actually in oral maxillofacial surgery, but I'm working towards that goal. Like I said, I have 2 exams coming up. One is oral histology and embryology, and one is oral anatomy. And I had a quiz on Friday. So it's like quiz after assignment after quiz. We have had a few research papers that we had to present. Dental pulp testing was one, and the last test we had was with regards to regeneration of the cementum. We had to actually debate that in class. It was interesting, very difficult because the paper had in a whole bunch of cell modulators and things that you generally wouldn't, pick up unless you were into molecular or cellular biology. But it was informative. I'm studying. I'm trying. I'm actually approaching dental school a bit differently. When I was in medical school, I was telling some of my colleagues in dental school that I tried to read the books. And I must say that's not always the best route because you don't have much time. And to read all those books, especially some of these books having all 700, 800, 900 pages, it's very challenging. I found that my grades in medical school suffered as a result. When I got to do my MRCS examination, everyone told me, read the book, but do questions. and the questions allowed you to pinpoint information that you need. And I'm just going to use that method for dental school, and I'll tell you if it works or not. If it doesn't work, I'll tell you, and I talk very frank. I'll tell you if I fail or not. Okay. Every time I try to read books, I get very frustrated. I don't know what it is. It's not that I'm dyslexic or anything. It's just that when I read books themselves, like, it can be very discouraging, especially if you've spent your whole day and you've only read half of a chapter and you have an exam in 3-4 weeks. Very few people can have the ability to read through a whole book within a month. So that's the challenge there. So right now I'm actually learning the branchial arches, and I did a video about that before. I just learned about reviewed the whole development of the neurotube and the neuroplate, and the endoderm, ectoderm, mesoderm. So this actually takes you, the notes that I'm reading actually takes you through the whole embryological development of the human being, and then it's going to start getting to the point, hopefully. I'll keep you posted how it goes. I may do a video tomorrow, so I might just get frustrated around the same time tomorrow. So hope you guys enjoy. See you later.